Great. So again, welcome to July's Tobacco Free Tuesday. We're really excited to have Michael Scott with us, and Rita will introduce him in just a moment. But for those of you who've joined us before, I think you know we like to start with our question, what's the tea with tobacco? So I'm going to go ahead and bring that up and launch the poll. So today's question is, what is your biggest concern about menthol cigarettes and tobacco products? So they are perceived as cool or healthier. They have been intentionally targeted to certain communities. They make it easier to start and harder to stop smoking cigarettes. They were excluded from the 2009 cigarette flavor ban. They are a social justice issue. Banning them will unfairly affect Black Americans more than other tobacco users, or banning them will increase a Black market demand or post-production menthol additives. So there's no right answer here. Please just tell us what your main concern or concerns are. We'll give you another couple seconds here to pick one. All right, a couple more people. We'll let you guys get a chance to poll. All right, let's see. Here are the results. So that's interesting. A lot of these were chosen, but the one that was chosen the most is that they've been intentionally targeted to certain communities, which I know Michael will be covering today. Thank you for that. And I'm going to pass it on to my colleague, Rita Miller, our cessation coordinator with Quit Now, Virginia, who's going to introduce our speaker today.
Thank you, Sarah. Good morning, everyone. And I bring you greetings and a welcome from the Quit Now, Virginia side of the house. We are thrilled to have Michael with us today, and it is my pleasure to introduce him. Michael Scott was hired at the Center for Black Health and Equity in October 2015. He currently serves as a chronic disease program manager overseeing tobacco, cancer, and HIV/AIDS prevention and education programming. He has 18 years of public health experience on the national, state, and local levels. His work has focused on disease prevention in the areas of HIV, diabetes, cancer, and tobacco use prevention. Prior to his position at the center, he served as a health education specialist at both the Durham County Department of Public Health and Duke University Medical Center. Michael holds a Bachelor of Science degree in health education from North Carolina Central University and is a certified health education specialist. I have had the pleasure of being in Michael's presence and listening to many presentations by him, and I have enjoyed and learned so much from every one of them. So it is certainly my pleasure to introduce you to him today. And Michael, I'm going to turn it over to you. Thank you for coming and being with us today.
Yes, thank you for having me. And let me bring up my slides. All right, cool. So I got the thumbs up that we are seeing the correct slides. So good morning, everyone. Thank you all, for having me on today for your Tobacco Free Tuesday. I'm hoping that we get some lively interaction in the Q&A at the end, and that the information that I provide is useful. I will also provide my contact information if folks have further questions. Today, I'll be talking about menthol, and that is been in the news a little bit lately. I'm sure you've all heard about it. So I'm sure there's questions around the FDA announcement. What I want to do is give a little history on menthol, how it impacts people's smoking and their ability to quit. I'll go into a little bit about the predatory marketing specific to vulnerable communities, a little bit about the history, but mainly what I'll be talking about is menthol and what is it about menthol that makes it so bad when added to cigarettes or to e-cigarettes. So let me start off with giving just a little background on my organization. And also a disclaimer, when we talk about tobacco in this presentation, strictly referring to commercial tobacco use, not traditional use as used by our Native American brothers and sisters who use it as a way to honor the creator, and their use is governed by protocol and for spiritual and ceremonial and cultural uses. And we're strictly talking commercial tobacco. As mentioned, I'm with the Center for Black Health and Equity, and we have been around for about a little over 20 years now. Specifically, originally, we were called NAPTN, the National African American Tobacco Prevention Network. And the reason this organization was created was specifically to combat menthol tobacco in African American communities. So while menthol has, just in the last couple of years, really become a mainstream conversation, organizations such as the Center, organizations such as the AATCLC have been in this fight against menthol, the addition of menthol to cigarettes for over 2 decades now. So that's how long that, our organization has been involved in this effort. Again, we were formed about 20 years ago, strictly for tobacco control reasons. Our original funding was strictly from CDC, the Office of Smoking and Health. We've expanded, we've changed our name from NAPTN to the Center for Black Health and Equity because we currently cover much more than just tobacco. We've grown into a health equity focused organization. And our funding stream has increased. Still CDC, but we also have funding from the HIV office, Robert Wood Johnson, the FDA, and all of our work is focused on increasing health equity within African American communities. And I got to mention that we're one of 8 networks that provide this type of attention to tobacco and cancer prevention as part of the CDC's national networks. I think I saw we call each other siblings. One of my siblings is on this call as well, Andrew. I want to say good morning to Andrew. But there are 8 organizations such as the Center that have a focus on specific populations that the CDC has identified as vulnerable, as a priority population who are disproportionately impacted by tobacco use. So we represent the African American community. As you can see on the list, there are 7 others, LGBT, folks with mental health issues, Hispanics, Asian Americans, those with low socioeconomic status, geographically defined, so like rural folks. All of these populations are disproportionately impacted by tobacco use. So today what I want to talk about is really how menthol impacts smoking behavior. Then as far as the menthol ban, menthol restrictions, being able to hear the opposition and know that it's false information that they're expressing, and being able to counter that with facts and with pro-health messaging that completely should cancel out what folks are saying, what the opposition is saying. So it's important to get that information out there. And then I'll provide some clarity around the recently announced FDA menthol ban. I know there's probably a lot of questions about that and how that's going to happen. So I don't have all the answers on that, but I do have some information that probably should be beneficial. So I think most of the folks on this call are already familiar. Tobacco is the leading preventable cause of death. So you look at any population in the United States, probably in the world, tobacco use is the leading preventable cause of death. You look at all the other leading causes of death, combine them, it doesn't reach the levels of tobacco and how much death and disease tobacco causes across the board. And we also know, working in tobacco control, that the smoking rates are constantly, consistently on the decline. We've gone in 50, 60 years, we've cut the smoking rates in half in the United States, which is awesome. that means we're successful in our tobacco control efforts. However, when you look at the types of cigarette smoking that is decreasing and the type of cigarette smoking that is either remaining the same or even on a slight upgrade, we can see that menthol flavored cigarettes are not decreasing the same as non-mentholated cigarettes. So we see here, and this data is a little old, but it's still accurate. Even more so if we include e-cigarettes. We know that, flavored e-cigarettes, all those fruity flavors are gone, but they still have menthol and mint. What's the difference between menthol and mint? Good question. I'm still trying to find an answer to that. But if we included menthol e-cigarettes in this graph, definitely see a little higher term for menthol use here. Now, so why the focus on menthol? That's why, because it's not decreasing like other cigarettes are. And when we look at who's smoking menthol cigarettes, we're seeing populations that are already vulnerable, already suffering from health inequities. African Americans almost at 90%, Asians over 50%, Latinos almost at 50%, the LGBTQ community at 36%. So we're seeing communities that are already suffering from, poor health conditions, lack of access, lack of health care, using menthol flavored cigarettes at much higher levels. And we'll get into, what it is about menthol that makes them a little worse than regular cigarettes. If regular cigarettes are bad enough, you add menthol, now it's a bigger problem, a bigger issue. And it's not just broken down into racial or male and female. There's quite a few different populations or subpopulations that are using menthol at higher rates. Women in general are smoking menthols at a rate of 40, maybe hard to see it, 43%. LGBT, we already talked about that. African Americans, it says 85%, it's a little higher than that now. But age, let's look at age. Youth, so youth 12 to 17 who smoke, over half of them use a mentholated product. 18 to 25, half. 26 to 34, more than 40%. And here's another interesting statistic, is income. When we look at income, folks that make between 10,000 and 30,000 a year, those folks that smoke, almost 44% of them use a mentholated product. 30,000 to 75,000, still a little high, 37%. And what's interesting about that is when we look at or think about just in general, which populations are more likely to smoke. We know minorities are more likely to smoke. We know folks with lower education and lower socioeconomic status are more likely to smoke. Now we're seeing that those folks are also more likely to use menthol. And that goes, and I'm sorry for the background noise, folks are cutting the grass outside, but that goes to really show how, when we talk about predatory marketing, which communities the tobacco industry is focused on with their product in general, but then also with menthol. So these communities smoke at high rates, but they're also using menthol at high rates. And when we talk about predatory marketing, we see much more marketing for these products in minority communities, low-income communities, and these communities are, again, already impacted by other social injustices. Adding menthol to it is just, more to the problem. So that's why we focus on menthol. Again, my organization has a focus with African American communities. However, I don't want folks to think that anything in this presentation, any improvements that we talk about, are simply going to impact African American communities. Because we know, again, 30% of the just the general population smokes menthol flavored products. We know that menthol products are slightly over 30%, about 1/3 of the market. So any menthol restriction, menthol ban, while it will impact minority communities more so because percentage-wise, more of them use the product, it's also going to impact the general public. It's going to improve the general public's health as well. So just really quickly, again, some of the reasons why we focus on menthol. It makes cigarette smoking harder to quit, easier to start. Youth, when youth start using a tobacco product, 9 times out of 10, they're going to start with a flavored product. A lot of times that flavored product is going to be menthol. Again, 65% of young smokers say they would quit if menthol cigarettes were banned. So that's an important stat to keep in mind, the number of folks who would quit if menthol was banned. And this is just a quick estimate. If menthol had been banned, back when other flavors were banned, 320,000 lives could have been saved. And we'll talk a little bit more about statistics like that later on. So what is menthol? I mean, we've all heard of menthol, but what exactly is it? And what does it do to cigarettes to make them so much worse than regular cigarettes? Well, just in general, menthol in and of itself is not bad. It's an organic compound. It comes from peppermint, corn mint, other mint oils, but it can also be made synthetically. And this is what it looks like. It's a waxy crystalline substance that can be clear or white, solid at room temperature. It melts slightly above, but it's an organic compound. It's natural. So when we think about how it was marketed back in the day, it was marketed with a healthy connotation to it. And this may be why. So just in the chat box, feel free to type some answers in. I'm going to ask a question. Menthol product, besides cigarettes, any other tobacco product, what are some products that come to mind that include menthol? So when you think about menthol, besides tobacco products, I'm thinking cough drops, exactly, and that's my first example. Cough drops, skin creams, gum, medicines, vapor rub, back rubs, exactly. Also, toothpaste, conditioners, lotions, a lot of stuff you find at the drugstore or in your medicine cabinet. So there is a slightly healthy connotation to menthol, and that's where that marketing initially came from. Years ago, menthol cigarettes were actually prescribed by doctors to folks who had asthma, which is great. And we'll talk about what impact menthol has in a couple slides. But by the numbers, I did mention that more than 30% of cigarettes sold are menthol. And that's menthol as a characterizing flavor. Now, when we look at tobacco products in general, about 90% of cigarettes, almost all tobacco products, contain some level of menthol, even if they're not advertised as menthol cigarettes. So just looking at a few products, regular cigarettes, menthol cigarettes that are weak, menthol cigarettes that are strong, we see the menthol level in milligrams. So 0.003 for your regular cigarettes. So your regular box of Marlboros, they have menthol in them. Menthol lights, that's about 0.1 to 0.2. Strong, so we're talking like Newports, the Camels have 0.25 to 0.45. And I think what a lot of people don't take into consideration is pipe tobacco and chewing tobacco. Those products also contain some level of menthol. And when we talk about menthol as an additive to cigarettes, I like to quote one of my colleagues, and I know many of you on the call have probably seen him, heard of him, Dr. Phil Gardner. He said, menthol is the ingredient that helps the poison go down easier. So we know in tobacco products, in cigarettes, in combustible products, there's thousands of chemicals, dozens of cancer-causing agents, and the addition of menthol just helps you ingest more of that into your body. But what menthol does is it masks the harshness of tobacco, and that's why we see some level of menthol in every tobacco product, because without the addition of menthol, the use of tobacco products would be just too harsh. It provides a cooling sensation. It activates your taste buds, your cold receptors. It increases the throat grab. So folks who are trying to quit and have gone to e-cigarettes, and this is back in the day when they were doing research trying to perfect e-cigarettes, the one thing smokers said was they wanted that throat grab, and that's what menthol. It helps, increase that feeling of, the smoke hitting the back of your throat, and it provides an anesthetic effect. So it numbs your throat a little bit. It numbs the cilia in your lungs a little bit. So now you're able to inhale more, inhale deeper, and inhale longer, which means you've got more nicotine entering your system. You've got more cancer-causing carcinogens entering your system. It increases salivary flow and transbuccal drug absorption in your mouth, which for combustibles, it still impacts, because you're inhaling, you're ingesting the smoke, you got some smoke in your mouth. But going back to the other products, so, folks that dip, folks that chew tobacco, they've got that menthol in there, and it's opening up their taste buds. It's opening up that transbuccal drug absorption in their mouths. And again, greater cell permeability. So it opens things up. When we talk about back in the day, when menthols were prescribed to asthmatic patients, it has the same effect. It kind of opens up the lungs and it allows you to breathe more. But if you're putting that into a cigarette, it's also allowing you to breathe in more of all the poisons that are in that cigarette. So as public health professionals, we know, hey, we need to get rid of menthol. It's no question. What's the holdup? And we had the opportunity. Many of you are familiar with the Family Smoking Prevention and Tobacco Control Act of 2009, so 12 years ago. The major impetus of that law was to prevent smoking initiation, to reduce the attractiveness of smoking, to increase cessation efforts, and to protect families, secondhand smoke, thirdhand smoke. So the whole purpose of this was, and it's in the name, the Family Smoking and Prevention and Control Act, to protect families. However, when we look at who was protected by this act, there was a few populations that were left out because the flavored cigarette that they used was left out. So all other flavored cigarettes were banned. Back in the day, you could get, just like you can get all these flavored cigars, there was a small niche market for flavored cigarettes. Coffee flavored cigarettes, chocolate flavored cigarettes, the little beaties that had different fruit flavors, all those were banned. So, there's some protections there. However, if the flavors were the main issue, the biggest flavor out there was menthol, but that was exempted. So when we talk about a social justice issue, health equity, this Smoking Prevention and Tobacco Control Act, it did provide a certain level of protection, but it also left out a big proportion of folks that weren't protected because the flavor that they used was exempt. Now, with some pushback, organizations such as the Center, organizations such as AATC,
We got to bring hot chocolate in.
We're
going to bring this in?
We said, wait a minute, this is not fair. So we provided some pushback to the FDA. And eventually the FDA conducted their own studies and came back with reports in 2010 and 2011. This one is from the TPSAC report of 2011. The removal of menthol products from the marketplace would be beneficial to the public health. From the FDA, from TPSAC, cut and dry. But yet it took 10 years before they finally took action. So back in April, the news came out, the FDA is going to ban menthol. Now, we know how it's going to take some time. So we don't have a timeline, but they have finally committed to doing something. And what this ban covers is menthol as a characterizing flavor in cigarettes. We mentioned that cigarettes, all cigarettes pretty much contain some level of menthol. This ban by the FDA only impacts menthol as a characterizing flavor. So only your Newports, your Cools, your, any of your cigarettes that come in the green packaging now. And I think a lesser known part of this is that it's also banning all characterizing flavors, including menthol, in cigars, which really impacts minority communities, youth, because when we look at what that part of the ban covers, really is these little cigars, these flavored Swisher Sweets, these Black and Milds that are extremely popular with African Americans, especially African American youth, but also youth in general. When we look at what tobacco products youth are using, flavored cigars are usually in the top 3 across the board, no matter what race we're talking about. But definitely in middle school and high schoolers, we see the use of the flavored cigars is extremely high. So this FDA announcement includes those as well. Now, what it really does is it just adds to the existing list of prohibited flavors. It's not comprehensive. It does not address e-products or smokeless tobacco. So we know that menthol in e-products is the #1 flavor. Now it's the only flavor allowed. So they allow tobacco flavor and mint flavor, which, in my eyes, in a lot of folks' eyes, menthol, it's just a matter of time, hopefully, before, mint is included as a flavor, just like menthol. I don't understand how they're getting away with, calling it mint and not menthol, but I'm researching that. And there's no official timeline. I know a lot of folks are like, well, when's it going to take effect? How long is it going to be before, it's actually a law, a rule on the books? Hard to say. But the process will work something like this. Within a year, so the announcement was in April, so by next April, the FDA will have to release an official notice of proposed rulemaking within a year, supposedly. After that, there'll be a public comment period where folks will have the opportunity to, give their thoughts on the ban and how they think it's going to impact their communities. And then they'll finally will draft and publish the official rule. That could take years. So we know just the way it sits right now, it's going to take at least 1.5 years. But we know that the big tobacco is going to come in with lawsuits, holding everything up. So it's going to be a while. It's going to be a while before this is official. That's why we still promote local, state level bans and restrictions where available. And we also promote pro-health messaging, because we know that with the ban comes big tobacco and their false narratives, which with their budget, they're able to get those messages out there much more than we are in public health. And a lot of times the first thing that people hear is what they go with. But we want to provide information that public health professionals, tobacco control professionals can use as a rebuttal and as educational, a means of education to communities, to tobacco control programs, how to deal with these false narratives. Again, I'm going to quote Dr. Gardner. Menthol cigarettes are an unequal opportunity killer, disproportionately hooking young people, African Americans, other people of color, harming their health, reducing life expectancy. So again, there's a disproportionate impact with menthol cigarettes on these already vulnerable communities. But we do know that we have success. Right now there's over 300 US jurisdictions that have some type of flavor ban, including menthol. We know that there's countries, Canada, the European Union have banned menthol. California and Massachusetts are the first two states to completely ban the sale of menthol. And of course, there's always some considerations. It can be sold, at an adult shop, or you have to go across the river, across state lines, and pick it up. But it's still a process. It's still progress. Still progress. So along with the bans that have already gone into effect, with the announcement of the national federal ban, there's opposition. One of the biggest things is it's racist. To ban the cigarette Black people smoke, other folks can get their hookahs and cigarettes, so should Black people. Which, this is coming from an African-American pastor during a panel discussion. So it just goes to show how misinformed some folks are around, what a ban on menthol really does, what the real impact is. So to counter that, the pro-health message is that it's a social justice issue. The reason Black folks smoke menthol cigarettes at such a high rate, that's the racist part, because they were marketed, predatory marketing, specific to African-American communities, low-income communities. That was the discriminatory part. But it's become ingrained that menthols are the Black cigarette. And big tobacco has, taken advantage of that and ran with it. So another opposition point is that, if you ban menthol cigarettes, it's going to create more opportunities for criminal justice interactions, specifically with, Black and brown young men. It's going to give them, or give police, more opportunity to interact, to involve people into the criminal justice system. And that's more of a policing issue than a tobacco control issue. And we also know that getting rid of menthol will save Black lives, and as I mentioned in the beginning, many other lives. And this is just a quick estimate of the lives saved if menthol had been banned with the other flavors. So if there would have been, we know we're going to see a decrease in initiation and an increase in cessation. So if there was a 10% decrease, or a 20%, or a 30%, these are the numbers of lives that could have been saved had menthol been included. Also, pro-health is that, a comprehensive menthol and flavor ban does not include police or law enforcement as the enforcement entity. Even with the FDA rule, they state that the ban only targets manufacturers, distributors, wholesalers, importers, and retailers. So there's nothing about, possession, use, or purchase being punitive, even when the FDA ban becomes official. And that's something to keep in mind for local and state level. If you're trying to do something at the local and state level, make sure that there is strictly no police or law enforcement involved in the enforcement. And that's the biggest question, is enforcement. Even with just plain smoke-free rules, smoke-free laws, the enforcement issue is always a question that I don't think, it's going to be a while before we have a really concrete answer, and maybe we can talk about that in the Q&A. Let me run through these last couple of slides so we can get to that Q&A. So other talking points as far as pushback from the opposition. Again, it's a health equity and social justice issue. We're seeing specific communities targeted with the product, and as a result, higher usage rates, higher rates of what results from that: cancers, illness, disease, secondhand smoke exposure to families. Another question is, won't there be a rise in the Black market? We have not seen that. Again, Massachusetts, California, Canada, the European Union, they banned menthol, and there's been no increase in Black market. There's been no crime syndicates taking over the menthol market. It's just propaganda from big tobacco. And the data doesn't support it. Another question is, wasn't it an issue of personal freedom? Well, we have to think about it like this. The FDA is charged with regulating products that threaten the public health. So food, drugs, cleaning products, cosmetics, things like that. If one of those products is impacting folks and showing negative health consequences, taken off the shelf immediately. So tobacco in general fits that description. And that's a whole nother story. It's a whole nother question. Is, well, why don't we just ban everything? We'll take the battles. We'll fight small battles, but the end game is eventually to rid the market of tobacco. But you know, taking it step by step here. And this is just a couple of links to some really good information from the Public Health Law Center. From rebuttals and facts, I went over some of them. This document goes into a little more detail. And then this supplement to the citizens petition. This is a document that provides a really comprehensive background that tells of the past efforts against menthol, some of the background information and research that supports, you know, what led the FDA to finally make this decision. And these are, yes, they are active links. So I would definitely suggest folks going to these two sites to really get some data that can be used in your educational endeavors. And with that, I'd like to end the presentation part and go into some Q&A. I haven't been looking at the Q&A, the chat. So Nicole, if you could kind of give me some of what's been asked, or if you're okay with folks coming off mute and asking questions, I'm good with that as well.
Hi, Michael. This is Nicole. Thank you so much for that great presentation information. We have one question in the chat box from Lindsay, and she recently asked, do you think the major difference is that Europe has universal health insurance for its people and therefore has a stake in the health of its people instead of profiting off sickness and cancer like the US? And Lindsay, feel free to take yourself off mute if you want to expand on that question.
You know, that's an awesome question. And I think that may have something to do with it. I mean, I think if the national government has a stake in, well, ours does too, but we also, tobacco is definitely a major source of income for, the country. We also have, my organization provides a training on, the history of tobacco in African Americans and how tobacco money is really the backbone of our economy, even to this day. But back to the question as far as universal healthcare in Europe, I think you make a good point. I think that it probably does play a role. And then again, I think I'm not sure of how much tobacco plays in as far as like the gross national product for European nations. But I know that for us, for here in the United States, I mean, it's like, again, it started as the backbone of our economy, and it's a major moneymaker. And that's what it boils down to. Even though we know that if we got rid of tobacco products, if we got rid of menthol products, we're going to see an increase in health. This is going to roll over into less healthcare, more productivity in the workplace, and in the long run, it turns out to be more profitable to have a healthier, country. But I think 9 times out of 10 folks are looking at it in the short term and not in the long term.
Thank you so much for taking the time to answer my question. I just keep thinking about, the very powerful medical lobbies, and the amount of money that they can make off a single person who is diagnosed with a chronic lung disease or cancer is a lot of money. And so on top of the big, powerful tobacco lobbies, we also have the medical lobbies lobbying to keep tobacco around for various reasons, which is just, it just makes you think about if we could get to a place where we could have healthcare for everyone, how would that change the landscape of being able to have a stake in everyone's health and everyone being healthy, as opposed to the opposite?
Right. Because if the government was in charge of having the responsibility to pay for the resulting sickness from tobacco use, well, I think it's like in Europe, we'd see a slight change in how they see it. So,
Yeah, because even the addictiveness of their jewels, because of the lower nicotine bar, because they can't sell the jewels that they sell here in Europe, is because they are trying to protect people and use it, you know, as the tobacco companies say that it's being used as a cessation device. And so hoping that it doesn't create that big addiction by using less nicotine is because of their laws, because hopefully that they have a vested stake in their people, but still allowing them the freedom that we have.
Right. And then when we talk about, you know, menthol and how it impacts smoking behavior, again, we know that it's harder for menthol smokers to quit. A study just came out last week, one of the largest studies regarding menthol smokers and cessation. And again, it just proved a point. Menthol smokers find it more difficult to quit. Interesting enough, they also found out that when menthol smokers, in their quit attempts, they were more successful if during their quit attempt, part of their journey was switching to non-mentholated cigarettes, which is, again, key in realizing that menthol impacts your level of addiction. So menthol definitely impacts cessation rates, not only in African-American smokers, but menthol smokers in general.
Yeah, thank you so much for that valuable information. I appreciate you. Great presentation.
Thank you. I know I've got a couple more minutes. I see that question about drug and alcohol use, and unfortunately, I don't have any factual information on that. But we do know that if you have, you know, what sometimes we hear as an addictive personality, you know, that using nicotine products, tobacco products, using alcohol, using drugs, we see a more likelihood of being addicted if you have that addictive nature, that intrinsic addictive nature, if that's even such a thing. But we do see it, you know, more people using, you know, alcohol and drugs along with their nicotine addiction. And sadly enough, a lot of times in rehab, folks are, you know, if not encouraged, you know, they're not discouraged. Tobacco cessation is not included in their treatment plan when they're trying to get off alcohol, they're trying to get off opioids, which is unfortunate because you're, in a sense, you know, not really promoting the addiction. But, you know, if you're going to fight an addiction, you know, get rid of all the addictions. Because we know that the nicotine addiction is probably stronger than the other addiction.
Michael, can I just add to that really quickly about youth using tobacco? So we have heard that it primes the brain for other addictions. So that's what
Right.
a director at NIDA says, which is makes sense to me. And then when we look at what youth are attracted to, it is the flavors. So they're more likely to use the flavored product, as Michael showed in his presentation, and they're more likely to try the vapes, which have high levels of nicotine, and then the brain gets used to that nicotine while it's still developing up to the age of 25. So that's a whole nother presentation we can get into, but that is why we're concerned with youth being attracted to menthol, to other flavors, to the flavors in cigarillos, and to the flavors in e-cigarettes as well.
And then there's a question regarding heated tobacco, the heat not burn products, and will they be included in the FDA's proposed ban? And I think that's an awesome question, and I don't have an answer that's based on data, but based on how the current rule is written, it only impacts combustible cigarettes and cigars. So this heat, again, big tobacco, they know what they're doing. The heat not burn products are probably when things go to court, they're going to want to include heat not burn in any type of exemption because it's not combustible. You're not burning it. And that's what they do. When flavored cigarettes were banned, all they did was, instead of making it a flavored cigarette, now it's a flavored little cigar. So instead of wrapping it in paper, now it's wrapped in tobacco leaf. Same thing, same flavor, but it's a small cigar, not a cigarette. So they're masters at finding the loopholes and creating new products that, you know, bypass any new legislation. So it'll be interesting to see if those are included. But my understanding, the way it's written, Big Tobacco is going to try to get those to be not included and be exempt.
Thank you, Michael. I want to go back. I know some people submitted some questions when they registered through Zoom. So just to kind of bring that back, I know one of the questions asked if the ban will include e-cigarettes and tobacco and other tobacco products. So I know in your presentation just now, you said, you know, it is just combustible cigarettes and cigars. So we hope, you know, that more products will be included. But as you said, we know that Big Tobacco is very strong and have really good lobbyists.
Yeah.
Definitely. And then we have 3 other questions. One was about a timeline for the FDA. I know you said we don't have a clear timeline, but I wanted to reiterate from your presentation, you talked about the process. So you said within a year, there's supposed to be a notice of proposed ruling, and then there'll be 90 days for a comment, public comment period. So anyone can comment on that. And then there should be a draft and then a published official rule. Is there a timeline for the draft and official rule, or no?
No.
There's no requirement.
There's no requirement. And this is where the lawsuits are going to come into play. Big Tobacco is going to jump in, file a lawsuit, which is going to put a stop to the progress until the lawsuit is settled. So we can bet on seeing that happening, you know, quite a bit. I'm sure there's going to be more than one lawsuit. But, you know, we have had success. So the lawsuit that was filed, there was a lawsuit filed just last year by Action for Smokers' Health, AATCLC, National Medical Association, that probably played a big role in this FDA announcement finally coming out. And again, like I said, our organization has been fighting against menthol as an additive for 20 years. So, you know, given the current political climate of the nation, that probably played a role in why the FDA finally said, all right, we're going to finally do something. But again, I think one of the take-home points is that, you know, it's an equity issue and it's a social justice issue. This is going to protect a lot of folks, and a lot of these folks are already suffering from vulnerabilities in their health, and mentholated tobacco is only increasing that.
Definitely. Another question we had was, are there any differences in quitting tips / techniques for someone quitting menthol cigarettes versus non-menthol cigarettes? And I know you talked about the recent study that came out saying that menthol makes it easier for people to start and get addicted and also harder to quit. So any tips, anything different you would suggest or have heard of?
Yeah, definitely. Especially for when you're talking about, you know, tobacco treatment specialists and you know, these smoking cessation classes. It's not one size fits all. So, you know, dealing with a non-mentholated smoker versus someone who smokes menthol, we know that the menthol smoker is going to have a more difficult time. So there needs to be a separate protocol, like for the quit line. I know some of the quit lines already have a separate protocol for menthol smokers. But with the menthol smoker, you know, we do know it can be more difficult. There may need to be an adjustment to their quit plan. And again, one of the tips that we just heard of was part of the plan is to go from menthols to a non-menthol in their quit process. And I actually, years ago when I did cessation classes, that's the technique I used. And there's a smoking program out of Duke University. I can't forget the name of it. I forget the name of it. But as opposed to going cold turkey, they called it going warm chicken. So even if you're a non-menthol smoker, we would look at the nicotine level in your specific brand of cigarette and switch to a brand with a lower nicotine content. So you're weaning yourself off of the nicotine. And with a menthol smoker, you would go from a menthol to a menthol light, then to a non-menthol. So you're slowly, reducing your nicotine ingestion and making it a little bit easier when that quit day finally comes. Because regardless, you're going to have, the cravings. But going from, a product that has 0.25 milligrams versus quitting a product that has 0.003 milligrams of nicotine, the addiction and the urge is not going to be as strong. But that would be my biggest tip, is to, if you're a menthol smoker, include a non-menthol in your quit journey.
That's great information. Thank you. I like Sarah and I said we like the warm chicken analogy. That was funny. The last question someone had when they registered asked about how we know most cigarettes have some amount of menthol to help smooth the harshness of smoking them. So do we expect that FDA will allow some menthol to remain in cigarettes, but ban those considered menthol brand? So I know you said, can you kind of expand? I think you talked about how the rule only bans those cigarettes that are characterized as menthol. So just those that are labeled as menthol, correct?
Correct. So the ban will only cover menthol cigarettes that have menthol as a characterizing flavor. And where does the menthol content become a characterizing flavor? We don't know. I don't know. I know that it's got to be a certain level that, okay, once you get to 0.2, 0.3 or whatever, now it's a characterizing flavor. So I need to do a little research and find out where that point is. But what I can see happening is, cigarettes that have, a low menthol content level, I can see big tobacco upping that a little bit to the point where, okay, it's not a characterizing flavor yet, but it's still increasing the menthol content. I can see them, and actually this was a concern I had, because they talked about reducing the nicotine levels in cigarettes to make them non-addictive at one point. And this was prior to the menthol ban announcement. So my concern was, okay, if they reduce the level of nicotine, there's always the chance that they could increase the menthol content. Because we know if they increase the menthol content, the body is still going to be able to ingest more of the nicotine that they've just reduced. So I'm glad that, the ban is here, and that at some level, menthol will be banned. But unfortunately, only as a characterizing flavor. So we're still going to be able to add it to a certain level.
That's interesting that you talk about the lowering the addiction nicotine, or lowering the content of nicotine, and then talking about menthol as well. So that's something I haven't thought about. I know we have one more question that just entered. So I'll ask that, and then I'll pass it on to Sarah for the kind of follow-up question. So James Key asked, if and when this legislation takes effect and e-cigarettes are not affected, do you think that tobacco companies shifting toward greater production of e-cigarettes to sorry, I think I read that wrong. Do you think tobacco companies will shift towards greater production of e-cigarettes to compensate for the loss of menthol cigarettes?
Yes. Plain and simple, yes. I mean, they're already doing it. And they are also moving into legal marijuana. So, as much as big tobacco is promoting the fact that we want people to quit smoking, that's not really a smart business model.
I think we see that with Altria's smoke-free world that they have going on.
Right.
Yeah, so it's all about that marketing, right?
Right. So that's what they're doing. They're moving towards the e-product with the proclamation. We want folks to quit. We just want you to, ingest your nicotine with this product instead. So we're still going to maintain your addiction, just not with this product. It's really
very tricky, very tricky. Yeah. All right, well, thank you so much, Michael. And I'm going to pass it on to Sarah to wrap us up.
Thank you, thank you. And I believe my information was somewhere in the chat. So if folks have other training requests or questions, please feel free to reach out.
And thank you again, Michael. I just want to add the Center for Black Health and Equity. If you are not on their mailing list, I highly encourage it, as well as the other CDC groups that Michael shared that address health equities. They send out great information from their newsletters. And if there is an opportunity to give feedback to FDA, hopefully that will be on our national partners newsletters, like the Campaign for Tobacco-Free Kids. And so if there's an opportunity for those of you who are interested to educate the FDA and to say that we want flavors also to be banned with electronic cigarettes, it's those national partners that we turn to for that information. And then of course, us on your state tobacco control team will hopefully share things as they come down the line as well. But we do want to return to the question we asked you at the beginning. And just like at the beginning, there's no right answer, but we are curious after hearing Michael's presentation, if your concerns have changed, if they've stayed the same. But we want to know what your biggest concern about menthol cigarettes and tobacco products, what your biggest concerns are. So this is multiple choice, but we'd love for you just to choose one. But if you're really torn, feel free to click more than one as well. But is your biggest concern that they're perceived as cool or healthier, that they've been intentionally targeted to certain communities, that they make it easier to start and harder to stop, that they were excluded from that 2009 cigarette flavor ban, that they're a social justice issue, that banning them will unfairly affect Black Americans more than other tobacco users, or that banning them will increase the Black market demand or post-production menthol additives. So there's just a couple more coming in. So now's your chance. All right, let's see where our results stand. Okay. Yeah, still the leading one was they make it easier to start and harder to stop, followed really closely by the one that was the lead at the beginning, that they've been intentionally targeted to certain communities. And thank you again, Michael, for addressing a lot of those that were in our poll results.
Definitely welcome. And just really quickly, as far as the targeted marketing, we definitely have a training that really goes into more detail about that. So again, if folks are interested in that, feel free to reach out.
Great. And we appreciate you all staying with us. We keep switching our Tuesday, but we're keeping our tobacco-free Tuesdays, but we're switching to the third Tuesday of the month. There were several conflicts that came up with the first and then the second Tuesday of the month. But starting in August, we will stick with the third Tuesday of the month. So we hope you all can join us. We'll, of course, send a link to register. But August 17th, we're actually going to cover 2 local tobacco control programs. So we're going to hear from some of you about the great work that you're doing around Virginia, which we hope to make an ongoing feature. Every couple webinars or a couple times a year, we will highlight programs that are happening at the local level. So we'll hear from EVMS about their Rethink Vape campaign, and we're going to hear from Richmond City Health District's Free from Tobacco, which is a local grassroots cessation program that came out of a cigarette tax increase. So we'll talk a little bit more about that as well. So we hope you all are able to join us. Thank you for being with us today. And again, a big thanks to Michael Scott for that great presentation.